We have a lot of great folks in radio and TV and many others that are trying to help us get the word out, but why isn't there a state of emergency? Why isn't this a national news issue? You might see it every once in a while, but it's not out there as much as it should be when you consider what's actually happening. And so we can't lose sight of the fact that as we put numbers up there or percentages of increase, or I show you charts and data, that every single number you see represents a human life that was lost. And it doesn't stop there. These people have families, they have friends, co-workers. Many, if not most of you, maybe even all of you sitting in here today, you know somebody who's died of an overdose death. And that's why you're here. That's why you're investing time. That's why you care so much. This thing is impacting all of us, whether we realize it or not, directly or indirectly. With that in mind, I want to share some information with you about what overdoses and overdose deaths have looked like in St. Johns County so far in 2024. We're going to go through several slides here fairly quickly, but I want you to try to pay attention to what's on the screen and let these numbers sink in. So this data has been provided to us by North Florida HIDA. That stands for High Intensity Drug Trafficking Area, and it's an initiative of the Office of National Drug Control Policy at the White House. There's a federal acknowledgement that I need to share with you that says this presentation is supported by the Centers for Disease Control, the CDC, of the U.S. Department of Health and Human Services. Now let's talk about the overdose response strategy. This is a really cool, I know you can't see it, the slide's a little tough to read, but the overdose response strategy is an unprecedented and unique collaboration between public health and public safety, created to help local communities reduce drug overdoses and save lives by sharing timely data, pertinent intelligence, and innovative strategies. So the ORS team, which is on the next slide, for North Florida HIDA, is made up of a drug intelligence officer, his name is Scott Delano, and a public health analyst, Deborah Babin. These are key partners of ours at Project Opioid. I know many of the partner organizations represented in the room partner with them, and they do tremendous work in equipping us with data and information that we can utilize to bring awareness and to take action. So we're grateful for them. They couldn't be here with us tonight, but we just want to say how much we appreciate Scott and Deborah. And the first set of data we're going to look at comes from Essence. And Essence stands for Electronic Surveillance for the Early Notification of Community-Based Epidemics. That's why it's called Essence. That's why everybody refers to it as Essence. But the next slide shows Emergency Department All Drugs. This is suspected drug-involved emergency department visits by county of facility and age group for Q1 of 2024. That's January to March of this year. St. Johns County had 8 reported ED visits for persons under the age of 18 and 152 reported ED visits for persons 18 years of age and older. You may be wondering, well, give me a frame of reference. How does this compare to like the state of Florida? So statewide, there were 2,035 reported ED visits for persons under the age of 18 and 15,803 reported ED visits for persons 18 years of age and older. Next, we're going to look at a different system that's called biospatial. Biospatial combines EMS electronic patient care reports from a growing network of thousands of emergency medical service providers with other electronic healthcare data sources to support the missions of public sector and commercial healthcare entities. So this next slide is EMS under the age of 18, and it shows emergency medical service responses for suspected drug overdoses of children under the age of 18 by county of incident for Q1 of 2024, again, January through March. So St. Johns County had 21 reported responses to drug overdoses for persons under the age of 18 as compared to the entire state of Florida, which had 1,710 reported responses for persons under the age of 18. Let's look at 18 years of age and older. So this slide shows emergency medical service responses for suspected drug overdoses of adults 18 years and older by county of incident for Q1. St. Johns County had 186 reported responses to drug overdoses for persons 18 years and older, as compared to the state of Florida, which had 21,736 responses for persons 18 years and older. And then the last system, and I think this is the one that you might identify with the most, is called ODMAP. The Overdose Mapping and Application Program, ODMAP, provides near real-time suspected overdose surveillance data to support public safety and public health efforts in mobilizing an immediate response to a sudden increase or spike in overdose events. So we're going to look at ODMAP for Q1 of 2024. Now you can see the dots on the map, and that is, a snapshot of St. Johns County. I want you to kind of get an idea of, on the map, where you live, where it is that maybe you work, if you work in St. Johns County, where you like to go for, recreational activities. Just look on the map and see where you basically live your life as it pertains to St. Johns County. What you're looking at is a map of St. Johns that shows suspected overdoses for Q1 of 2024, January through March of 2024. During this time frame, there were 153 suspected overdoses, including 2 suspected overdose deaths. The next slide shows it broken down by month. So this shows the suspected number of overdoses by month for St. Johns County for Q1 of 2024. In January, there were 42. In February, 61. And in March, there were 50 suspected ODs. The next slide is going to show you suspected overdoses by day of the week. And this slide, as you can see, shows kind of an even distribution, except for Wednesday. The weekdays are slightly higher, all days of the week similar, except for Wednesday, which is about half of the average of the other days. I found this to be very interesting. I'm not sure exactly what we can pull from this, but it's something that we probably should consider. And then ODMAP, January 1 through May 7 of 2024. Again, locate your area where you frequent in St. Johns County. Once again, you're looking at a map of St. Johns that shows suspected overdoses, but this time it's for the time frame of January 1st through May 7th of this year. During this time frame, there were 227 suspected overdoses, including 2 suspected overdose deaths. So as you can see by this data, some of you probably could read into it a little better than others, but as you can see, just like everywhere in North Florida, substance use disorder is an issue in St. Johns County. But, as I said earlier, you can be a part of the solution. That's why we're here this evening. It's not just to take in this information and walk out and not do anything with it, it's to take this information in and see what we can do to make a difference. So I want to share with you quickly what to expect during the rest of our time this evening. We're going to hear the story of a mother who lost her son to a fentanyl overdose right here in St. Johns County. There's going to be a panel discussion with leaders from your community who are subject matter experts, and they're going to describe how this issue is impacting your county. And then you're going to see a brief presentation that outlines 2 things that every single one of us, all of us, can do to make an immediate impact on the overdose crisis. And then we're going to wrap up this evening by talking with a young man who has battled substance use disorder and is finding success in his recovery. So this time, I'm going to ask my friend, Shay Bryan, to join me on the stage, and we're going to have a conversation about a tragedy that she experienced recently. Good?
No, my prop's over here.
Yeah. So first of all, thank you for being willing to share your story, Shay. I know this is not easy because you've told me how difficult it's been for you. And for those who don't know, Shay lost her son, Alex, to a fentanyl overdose on January 8th of this year. And I think I can speak on behalf of everybody here this evening when I say we're so extremely sorry for your loss. And there are some that you know in the crowd, some you don't know. But I think we would all say that we're so sorry. Can you start by telling our audience what Alex was like? Is this on?
I've never gotten to do that before.
That's okay. Here we go. Now it's on. You just have to turn these things on.
Okay.
What was Alex like? And I think we have some pictures we can
Yes.
throw up on the screen too.
So, and I told Abby, I was like, thank you. She picked the pictures. I love that we have his long hair and his short hair. Because he did both. He would have the long hair, and then he would buzz it off. So what I did, because I have limited time tonight, is I went and read through some of the cards that were written and left at his funeral. And I thought it was really, I went to his room today, I was brave, and I read the cards. And so I thought I would let his friends and his coworkers answer this question. He knew how to help everyone turn their frown upside down. He was generous. He gave away any cash tips that were given to him. And what I know is his mom, he didn't keep cash because he was in recovery, and cash can lead to easy access to things he didn't want to use. He was willing to serve, loved his boots. He's a dedicated volunteer, a hard worker with a smile, lovable and chill. He made nights easier to get through. It was easy for Alex to make us laugh. He was unpredictable. He would come in and excitedly share his career ideas. And someone else wrote, Alex, you were a light and always knew how to make someone smile. Those were great things to read. And as his mom and Brad, his dad, we know there was a little storm underneath, a little storm that was brewing with some mental health challenges and some learning challenges at school. But he was very funny. And
Sounds like
loved.
somebody we would all love to know.
Yes,
Yeah.
he was a lot of fun, and you really did never know. You never knew what he was gonna say.
Yeah. So when did Alex start experimenting with substances, and what drugs was he taking?
I will say it's very tough to say for sure because with vapes they're tiny and you don't know. I would guess that maybe he might have messed around with some vapes in 8th grade, but really when he got to high school, he used vapes, cigarettes, he tried marijuana, he tried cocaine. His worst that he felt terrible, like the guilt and the condemnation and the shame. There was some guy at school and everybody was afraid of him, and he bought, I don't even know if it's a real thing, black tar heroin. And he could never, that was a big deal in his mind of just the worst of the worst. But he settled what he needed to calm his mind, and he found that he could get whiskey, and it was very portable, it was easy to get, and it helped shut his mind off quickly.
Yeah. So when we met to first talk about his story, you mentioned something that I wanted to share that I thought was really cool, and that was that he was open with you about his journey, even though he knew that some of those things were not things you wanted to hear. He was willing to share with you what he was doing, why he was doing it. And I wonder if you could share with our audience from his perspective why he felt like he needed to use substances.
Okay. So in 11th grade, he had mono, and he missed a lot of school. On his first day back to school and work, he got sent to the ER. He said he was just taking a nap, but he actually passed out and had whiskey with him at work. And when after he got, he assured us that he was okay. He was fine. He didn't know why he was there. But in the next days at home, he said, I can't go back to school without numbing my brain.
Yeah.
He had learning challenges, and the systems that we had put in place at school were not working. They were not helping him, and he was overwhelmed with the process of knowing that he learned differently and wasn't getting the help that he needed.
I remember a phrase that you mentioned during our conversation. He felt like he couldn't turn off his brain. And I connected with that because I feel like that's me sometimes. My mind is always just running, racing. And so I think you mentioned that he would use substances and even the whiskey to try to help him to come down a little bit.
Right, to turn his brain off. And we went to the doctor many times, as he would say, I can't sleep, I can't turn my brain off, I can't stop, I can't make it stop. And that's what the whiskey did. It provided that full stop, even to the point of going to the ER, that he just couldn't get the help for.
Yeah. Can you describe the sequence of events that led to his passing?
So when he told us that he couldn't go back to school without numbing his brain, I told him he didn't have to go again. That's all I needed to hear. He didn't have to go back. And we took him to rehab. He was willing to go. He wanted to be better. And his goal in rehab was to get his medicine straight. He wanted his medicine so that he could shut his brain off and function as he, I guess, thought was normal. And so through rehab, we did that. He came home, and he was active in recovery meetings here. He had speaker parts. He had just started in the STEP study, and 2 weeks before he passed an at-home drug test. We gave those randomly, and he would ask why. And I told him, because we celebrate your winning the battle over your addiction, and that was what we did. The week of Christmas, I went and I searched his room, and his room was clear. And these are things that when you've been in these places, things you never wanted to do, but you have to do. So the day that he relapsed, I had texted him that afternoon, come down and hang out with me. He worked late, so he worked the night shift. He would get in late, he slept late, and then he would get ready and go to work. So everything seemed to be normal. He didn't come down when I texted him and said, come down and see me, spend some time with me. He didn't answer when we called him down to dinner. And when we went up to his room, the door was locked, and he didn't answer the door. So we went in, and he was gone. I don't know how long. I think it was around 2 a.m. he had texted his sister about dyeing his hair the next day. And she responded on a school night at 2 a.m., but he wanted his hair bleached, and they were going to do it. So they made plans in 2 days they were going to do it. They were both off work, and so sometime after 2 a.m., he was gone.
So based on that, we know that wasn't intentional. It was something that, he was planning. He had plans for the next day. And I think it's important to really make that clear, because we're going to talk about fentanyl here in a minute more specifically. But what we're seeing is poisonings, that result in death for a lot of people that don't intend to overdose. And fentanyl is what, causes that to occur. And that's what happened.
Yes, so they did find some substances under his bed and some socks he had just gotten for Christmas. And it tested positive for fentanyl, and then later getting the toxicology. He thought he was getting cocaine, and he got some cocaine, but it was obviously laced with fentanyl. Right. So, yeah, it was totally out of the blue and unexpected. It was not, thankfully, we had not seen a struggle, and we had not had bad days. But at the same time, that makes it that much more shocking. Right. That it can literally happen that quick, unintentional, no signs it's going to happen.
What would you say, like one final word, one final thought to folks that are either sitting out here in the audience or maybe watching online, and they're in a similar situation with someone they care about? What is one final thought you would share with them that you want to leave with them?
I would say you're not alone. Please talk to somebody. Talk to multiple people. I brought this as a prop. This is my daughter's EpiPen. We take it everywhere we go, because you use an EpiPen in case of an emergency if somebody ingests something. that is harmful to them that they didn't mean to ingest, and it saves their life. That's the same, ignore my glasses. That's the same thing that can happen with Narcan. You can save a life for somebody who ingested something they didn't mean to ingest that will hurt them. So I would say we need to take away the stigma, take away they're bad kids, they're bad people, they are not like us, this will never happen, because how do you know something can happen? It's happened before, and it happened to us, and we will never be the same. So, and we are here to help save a life. We are here for hope, because even though it didn't end well for Alex, he's victorious in heaven, and we are going to help more people get there. So I think that's
well said. And Shay, I know you were concerned about sharing your story, but you did a great job.
Thank
and
you.
I want to say thank you so much for your courage. And can we give her a hand?
Thank you.
Shay. That's the reality of the situation. You just heard a real life example of somebody that lives here in St. Johns County. And it's happening all the time. A lot of you have people that you've lost that you love and care about. And I think the thing that she shared, you're not alone. It needs to be echoed and repeated over and over again. And there's a lot of folks, a lot of organizations who are here to say, we want to help. And I would encourage you to reach out. So thank you once again. Appreciate it. Unfortunately, in the story we just heard, the dangers of fentanyl took a life way too soon. The ripple effect's going to be felt forever. You just heard Shay say we'll never be the same. Holidays, birthdays, there's just a void that exists for people who lose loved ones to overdoses. And so let's talk about what we can do, because this is not an isolated incident. You saw every year tens of thousands of people die from this, and it's not a moral failure. It's a disease, and we need to talk about that as well. So this leads us to our panel discussion, and I want to invite our panelists to come on up, and they're going to have a seat and share with us some information from their perspective, and each of them are going to introduce themselves and tell you a little bit about what they do, and then we're going to jump right into the questions. We know our time is valuable here, and they have a lot of great information to share. So as they're getting seated, I want to start with Sheriff Rob Hardwick, St. Johns County Sheriff's Office. Sheriff, if you could just briefly introduce yourself, and then we'll head right on down the line, and we'll get going with the questions. So,
Sure.
yeah, flip that switch up. There you go.
Everybody hear me okay?
Yes.
So good evening, everybody. I'm Rob Hardwick. I'm the sheriff here in St. Johns County, and thanks for having us tonight. And I got to tell you, Shay and Brad, and please hold your head high, because you're not alone. You just happen to be the one that actually will come up on the stage and tell the story. But I feel like with every horrific incident that occurs in death, we get better and do something better. And the two of you are going to save lives, and we're here to help you. So God bless you and your family, and Alex, of course, as well. Thank you.
Thank you. Dr. Carrie Bachista, St. Johns County Fire Rescue.
My name is Dr. Bachista. I'm the medical director for St. Johns County Fire Rescue, and thank you for having me.
Rob Dickinson, Epic Behavioral Health Care.
First, TJ, I was excited when I heard there was going to be experts here, and I was like, where are they? No, seriously, folks. So I'm the lead nurse practitioner at Epic. I oversee the programs. We have detox. We have a residential program. We have counseling, pretty much any type of counseling you need, we got it. We have a MAT program, Medicated Assisted Treatment Program. And we have outpatient general psychiatry for adults and children from the earliest I've seen is 4 on up. So yeah, thank you.
Sir. Regional Superintendent Kyle Dresbach, St. Johns County Public Schools.
Hi, good evening. I work with all the secondary schools, former middle school principal and high school principal, and now work with different schools around the county. Really, our job is to partner with parents. And so we're here to help and do the best that we can, but we can only do that with you in support of each other. And so God bless you, and we hope that we can all get better from this.
Thank you. We're going to jump right in. First question is for Mr. Dickinson. Can you please provide an overview of the overdose crisis, including the different waves of the epidemic and what the crisis looks like now?
Sure. Yeah, so it looks like this primarily started back in the 1990s. We had wonderful medications. It seemed like there was an explosion in the late 80s, 90s. We have new opiates come out on the market. The manufacturers said these were safe. They were, very much addiction-proof or minimized addiction. But most of them, if you crushed them, it overrode that, and nobody knew that at the time. So there was a big push for providers, physicians, to treat pain, and so we began prescribing, and prescribe we did. And so that ended up into sort of an overprescribing situation. I saw one documentary called American Pain that's on Max, and people were boarding Greyhound buses, going down to South Florida, having their friends go in and get these prescriptions, and then come out, and they were giving them to the dealer, selling them to them for $50. And then they were distributing them up in like West Virginia. So that's what started the epidemic. And then, so that was the 1990s. And then in 2013, we had the second wave, and that was primarily heroin-based. And then present, 2013 to present, we're looking at the fentanyl. And that is a synthetic opiate. Now, like TJ said, what was the numbers? The current numbers was 111,000 deaths in 2022. To give you an idea of it, in 2020, those numbers looked like 60,000 deaths. So within 2 years, we've doubled the number of deaths.
And I think it's important to note that when we did shut down the pill mills, and by the way, I read something that said that Florida had 99 out of the top 100 prescribers during that whole, pill mill season of the overdose crisis. Hard to believe, but very much what you said. Buses coming down to Florida to get pills and go back to different states. But we implemented a prescription drug monitoring program, which required every doctor who's prescribing an opioid to put that into a database, and so that kind of cut down on the pill mills. But you had all these people who were addicted to these opioids, and that's when they turned to heroin, if I'm not mistaken. And then fentanyl's just caused damage that we never could have predicted. So thank you for sharing that. I want to go to Dr. Batista. What does the overdose crisis currently look like for fire and rescue personnel in St. Johns County?
Thank you. I think, unfortunately, we heard what the overdose crisis looks like. I mean, it looks like lives lost, but it does not adhere to any particular area of the county or any particular age group, as we saw with some of the data that was out. It's happening pretty much everywhere, all hours of the day, all days of the week, with Wednesday being a little less. I pulled a couple of numbers just to look at what we've had over the past couple of years. Last year we had 481 calls for overdoses, and it's been around that amount over the past couple of years, so it's still staying steady. The average age of our overdose calls is in the 40s. So this is not confined to just young people. This is not confined to older people. This is all ages. In fact, we were talking ahead of time. Last time we had one of these events, there was an overdose call going on down the street, and coincidentally, there's an overdose call going on right now with a 14-year-old who was with a friend, took some kind of pill, obviously laced with something, was having some sort of overdose reaction.
Doctor, but you talking about right now,
Yeah.
while we're, okay.
Yeah. So it's happening at all times. It's happening all places. There's really not, as you saw from the maps, there's not one area. All of our crews are responding to overdoses.
Thank you. I think that's surprising to some people who aren't familiar with, the information that you look at all the time, and for it to happen right now in real time just shows you what an issue that it is. Sheriff, what are some of the challenges the St. Johns County Sheriff's Office is facing in relation to the overdose crisis?
First of all, we're in a battle with a thing called overdose. It doesn't discriminate every race, creed, color, religion, sexual orientation, and age. As we sit here sharing a text with each other, we know our men and women are actually responding right now to a 14-year-old that's overdosed, whether it be accidentally or intentionally, we don't know. But that's not our job to discriminate. But the big thing we're seeing, of course, with the men and women of the St. Johns County Sheriff's Office is most of the time, majority of the time, we beat St. Johns County Fire and Rescue there. It's just the way the dispatching system actually goes. So our men and women are open and susceptible to this dangerous narcotics that, of course, we're touching, we're seeing, we're smelling, we're feeling as we provide first aid for these men and women and children sometimes that have been affected by these drugs. Last year alone, the St. Johns County Sheriff's Office administered Narcan 314 times. 314 times, and 9 of those resulted in a fatality. Not because of our actions, but you look at the results, and sometimes, of course, you look at Brad and Shay over there sitting there, and those 9, maybe one of those 9 were theirs, was Alex. But the other ones, of course, was our men and women actually supplying or providing the Noxalan. So, one thing one thing I say in the St. Johns County Jail is this, is if you come into my jail, and I hate calling it a jail, by the way. I call it a gated community with people that are there on a temporary basis. That's what it is, by the way. Because most people in there have made a mistake in life, no different than you sitting in this audience today, including myself. But they got caught. But with that being said, we have a saying in the St. Johns County Sheriff's Office that we're going to make you into something better than what you came in as. Everybody's got a story, by the way. And unfortunately, with the stories, sometimes consequences end and result in death. But, we're seeing this stuff, of course, and the first priority for my men and women, of course, when we get on scene is to save lives. It's just the way it is. It's no different than St. Johns County Fire and Rescue. And luckily, we have the training, we have the support, but the advanced life support is coming. But the initial response that we have is what is actually saving lives. So, again, it's those things, and this is on top of the men and women of the St. Johns County Sheriff's Office and the men and women of the St. Johns County Fire and Rescue, going from the last call is a car accident, the next call is a suicide, the next call is maybe just a theft, the next call is a 14-year-old boy, a child that's overdosed on some type of narcotic. So we also have to deal with mental health within our own agencies too as well.
We appreciate what both of your agencies are doing to address this, and I want to shift and talk to the superintendent, and I wonder what this is looking like in the school system. How is this affecting students on a daily basis?
Well, I'll kind of go back a little bit. I was the principal at a high school back in 2009, and it was kind of at the beginning, middle of the opioid crisis, where what we're seeing is not just the overprescription, but then parents not taking it all. And so it's left in their medicine cabinet at home. And so what we would see is students bringing those in to the school itself and either taking it themselves or handing it out to their peers. At least those were prescription medications, even though they were not prescribed for them, but you kind of knew where they were coming from. What started happening after that is it started to become more and more scarce. And so you started seeing more and more of these outside drugs that were starting to come forward. So you started seeing more and more of marijuana, you started seeing more and more of meth, all those things that you would typically hear about, but then it started becoming laced with fentanyl and other things. Because again, the scarcity is what was driving that up. And so you started to see that as you go through time from even just then in 2009 to now to 2024, that's more and more of what you're seeing is those types of drugs. But what I would also say is in addition to that is the technology itself. It's easy to be able to get a vape. You don't have to show an ID to be able to get a vape on Amazon. I can use my mom and dad's account. I can just go on the computer because it's still logged in from when they logged in and quickly be able to get a vape ordered and sent to the house. So there's all these things that make it unfortunately, more convenient and more readily available. What really we're struggling with right now is again, sharing of those types of items that we don't know where they're coming from. And so students, they say, hey, it's my buddy, they're going to share with me. And so I think they're going to keep me safe. Well, their buddy doesn't know where that came from either. And so they're getting a cartridge that may or may not be laced with something that they don't know about, or at a higher level than what they were used to in another time that they got a cartridge from someone. So those are the types of things that are happening. Again, we're very fortunate in our community that it's not happening as often, but every time it does is a tragedy, and we look for ways to, how can we get better? What are things that we can be able to do to try and help our students going forward?
You make so many great points there, and I think one of the ones that, and we're going to talk about how to address this, is, with prescriptions that are left over and maybe sitting in medicine cabinets that people aren't utilizing, and we know that that's a gateway for a lot of young people, especially who, get involved. And now you have the overdose crisis being driven by fake pills disguised as prescription meds. So to your point, you don't know what you're getting, and that's really kind of the message we want to drill into people's minds is, if you don't know where it came from, if it didn't come from your doctor or a reputable pharmacy through a prescription that was written for you, don't take it, because it could kill you. It could end your life. So thank you for that. Mr. Dickinson, based on several credible sources, we know fentanyl continues to drive the overdose crisis. Can you explain what it is and why it's so dangerous?
Sure. Fentanyl is a synthetic opiate that has been designed in a lab to be one of the most potent opiates. And this is primarily used in surgeries and for cancer pain. So opiates have been with us forever. Originally we had opium and morphine that was derived from the poppy plants. And then in the late 1800s, they made a synthetic form, which was heroin, which was stronger than the morphine. And now we have the fentanyl. Well, the fentanyl is 20 times more stronger than heroin and 100 times stronger than the morphine. So the unfortunate thing is that fentanyl is dosed in very microscopic proportions. So this is a penny, and that little white dot next to me, or next to my finger, that is a lethal dose of fentanyl. So this is highly controlled in the hospitals and highly controlled in the medications that you take. But when it hits the streets, who knows what you're getting?
Exactly. It takes just a fraction of amount to really do damage. So thank you for sharing that. Sheriff Hardwick, can you discuss the types of drugs your officers are seeing on the streets here in St. Johns County?
Sure, and I'll kind of name them from the top to what we're seeing the most of right now is fentanyl is number one on the list. Methamphetamine is a close second place behind that. And then cocaine, of course, is after that. And then heroin. And as dirty as heroin sounds, if some of you don't know, heroin is also an opiate. As Brad had just mentioned a minute ago, too, is, that's actually the base of, and of course our chemists from FDLE can tell you that, the base of that, of course, started with the complex of morphine. So we're seeing those on the street, of course, and the accessibility really is at an all-time high. There's one thing I have to kind of go back to when I was in high school right here in St. Johns County in a small Catholic school. It was big news when you heard someone had marijuana. I'm 53 years old, but when you heard marijuana, it was like, wow, someone's got marijuana in school. If you heard cocaine, it was like really, really big news. And you really didn't see a whole lot of it. And some of you might remember this, but 53 years old, there was a gentleman by the name of Len Bias. Some of you know who I'm talking about. He was #1 draft choice coming from our college. I believe it was University of Maryland. He did cocaine one time, and he overdosed on cocaine and died. Do some of you remember that story? I never forgot that story. It scared me my whole life as a young man. As I got older, I was always afraid to do that drug because I heard about a man overdosing on that drug called cocaine. And some things that my staff provided to me today is we've seized, in 2023, we seized 3,777 grams of fentanyl, 2,885 grams of methamphetamine, 2,373 grams of cocaine, and 94 grams of heroin. And it's on the same trend this year. And it's if we go, and my staff that's sitting in here today will tell you, if we read every 12 hours, we get an updated report on things that have happened throughout the nighttime for 12 hours and things that have happened throughout the daytime. So we'll get a briefing right now before we all go to bed. If we go one day, one 12-hour shift, without reading that we had some type of encounter with fentanyl, it's out of the ordinary. I mean, it's become a part of our life, of that we see fentanyl every day, which tells me that, of course, we're not even touching the spear tip of this, by the way. When I read these numbers off to you, it's nothing. And I even have a full-time interdiction team that works nothing besides 95 in the off-ramps. But I just simply say that because it's the fentanyl's top of the list. And as Brad said a minute ago, when I worked homicide for 12 years. And I worked an overdose down in Bunnell. And it was a friend of mine named Claude Sinach. If you're local here, his mom and dad used to own La Pavillon restaurant. And I got called down there to an overdose, and my friend Claude, I didn't know at the time, but he had taken a fentanyl patch because it was, I'm just going to say, a 3x3. And it was a time-release, basically, patch for cancer patients that were dying, terminally ill, is how I knew it. And he had injected, basically taken the gel out of the Band-Aid, per se, and had injected it into his arm and immediately died. I mean, he never got a chance to even push the needle into his arm. And that was my first kind of, my reaction to what fentanyl actually was. And now, of course, it's such a profitable market because of, Mexico is just producing it for so cheap and such a great high.
Are you seeing a lot of pills? When you say fentanyl, are you seeing those fake pills that look like an Adderall or look like a Xanax? Sure. Or is that what you're confiscating a lot of times?
Yes, and with our partnership, we have a full-time TFO, a task force officer on the DEA task force, and then we have people that work with the FDLE as well. So we're getting those intel bulletins all the time. However they can produce this illegal narcotic, to push it out to the users, they're going to push it out. So we're seeing it in every form you can possibly imagine, to include liquid.
Yeah, and you mentioned the DEA. They now tell us that 7 out of 10 of the pills they seize contain lethal dose of fentanyl. So pretty much anything that's on the streets that you're getting, on the streets is a potential deadly pill that people are taking. So
yes, sir.
Dr. Batista, who, and this is a kind of a rhetorical question, but I think you know where I'm going with this, but who is at risk for addiction to opioids and a fentanyl overdose, and why?
Yeah, I mean, I think that we kind of touched on some of this, that anybody who comes into contact with opiates, anybody who's using any of these substances is at risk for addiction. These are highly addictive substances by design, and they're very strong, and they're made to cause addiction, which is also why, to get into the second part of that, who's at risk for overdose. Anybody who's using pretty much any substance is at risk for overdose because of the highly addictive properties of fentanyl. It has made its way into fake pills, various other medications, people thinking that they're buying cocaine, people think that they're buying methamphetamine, and it's all laced with fentanyl because of its highly addictive properties. So I think anybody who's using any substance, and sometimes it's a pill that they get from a friend or something like that, and it's been adulterated. So anybody who's using any substance, I think, is at risk for overdose.
Yeah. Thank you for helping me, drill that point home. I think sometimes people feel like maybe they're untouchable when it comes to this, and because they know their friend or they know, they think they know their dealer, that they're not getting something that's tainted. But I know you could probably speak to how many times you see that over and over and over again. So.
And I think they're, bad actors are mixing the fentanyl in there, I think, because of the addictive properties of it.
And a lot of times we'll get the question, well, then why would dealers put that in their drug supply if it could potentially kill their customer? And you just answer that is because if it doesn't kill them, they have a customer for life, correct? They just...
Correct. And there's these are not FDA-approved labs that are making this, so they can't control the concentrations, they can't control how much is actually in there. So they may be unintentionally making a fatal dose.
Thank you. Regional Superintendent Dressback, how are you bringing awareness to students about this crisis we were talking about? How are you educating them on the dangers of fentanyl and illicit drugs?
So that's a great question. What a lot of what we do is that we do it as grade level appropriate as we can. So when you look at our elementary schools, we have Red Ribbon Week that happens in our falls, and so they are usually doing that with our school counselors, talking about the dangers of drugs, talking about how to avoid them, how to stay away from them. As we get into 6 through 12, whether it's middle school and high school, we are also providing 5 hours of mental health instruction. And part of that instruction does include the dangers of opioids and fentanyl. It also includes other drugs such as marijuana and THC. And so we do a lot of instructing on that. The other part that goes along with that is some of the work that we do with our teachers and providing youth mental health first aid training so that they can be able to start to notice signs of students who are in crisis or moving towards crisis. And so we look for both of those ways to be able to try and not just bring awareness, but also looks for signs and symptoms of our students as well.
It's really good. We appreciate all that y'all are doing. Mr. Dickinson, why is it difficult for someone to overcome substance use disorder, particularly when it involves opioids?
Well, there's several reasons. First and foremost is we have multiple neurotransmitters, and serotonin's one, norepinephrine's one, but dopamine is the big one when it comes to these illicit drugs. Dopamine is our pleasure chemical. So now, you take a bite of a nice piece of pizza and you like it, your brain releases a little bit of dopamine. That's like a BB gun. You do a hit of fentanyl, and that's like a shotgun shell to those receptors. So over time, what happens is a process called downregulation, where these receptors get so oversaturated that the brain adapts to that, and it actually kills off those receptors. So here's a picture, and I'm sorry that it's small, but the center one is a meth user who's been using for some time. So you can see that those receptors have died. And the one on the far left is the user that is recovered after 2 years. So they do grow back. So that's problem number one. Problem number two is the withdrawal. So opiate withdrawal will kick in about 8 to 10 hours after the user has last used. This is a life-threatening situation. They go into tremors, shakes, seizures, stomach, it's pretty graphic what they can go through. So I say, hey, I want to quit. Well, that's great, but now I start going into withdrawal. Now I got to go back out on the streets and score just so that I can stay level and essentially not die.
And so that kind of answers the question when people say, why don't they just stop? Like, they're ruining their lives, they're ruining the lives of their family members, why don't they just quit? We now know this is a brain disease, and their brain actually gets rewired because of the way that the chemical interacts with their biology. And I think it's important to note that everybody's chemical makeup's kind of different, and so it's going to affect people differently. So thank you for that great explanation. Dr. Batista, two-part question for you. Number one, what are some signs that a person has overdosed? And then secondly, what is naloxone, and how does it work to alter the effects of an overdose?
Yeah, so a overdose, somebody who overdoses is, if it's a pure opiate, they're going to become unresponsive. They're going to pass out, go unconscious. It hits the receptors in the brain that control breathing, so their breathing will slow down to the point where eventually their breathing will stop. And then after that, subsequently, your heart stops. They may turn blue, their lips may turn blue, but it's a pathway. Because of but that would be a pure opiate overdose. Some of the other overdose symptoms you may have depend on if you took something that maybe is a fake pill or an adulterated substance. So you may actually get combinations of different overdose type symptoms. But a pure opiate overdose is going to give you, as you saw on the screen.
And then second part, naloxone, what is it? And how does it work to alter the effects of the overdose?
Narcan or naloxone is essentially an antidote for opiates. It works to block the receptors that the opiates are attaching to, and thus prevent the opiate substance from activating those receptors and causing the overdose. So it works to block the effects of the drug.
And we have a diagram, or an illustration, if we could put that back up there. And is it true we all have those receptors in our brains that, have an affinity to opioids, and then?
Yeah, so your body has normal, sort of the pleasure receptors. Your body has opiate-like substances that are natural in your body. I mean, it's what helps you feel good. And these medications actually work to mimic those substances that are in our body. So we all have receptors that are opiate-like receptors. It's part of the natural chemistry in your body. But the Narcan will block those and just not make them available. And it's also important to know that Narcan, if somebody is unconscious and somebody is suspected of having an overdose, Narcan is not going to harm you if it's given and it's not an opiate overdose or something like that. It's not really going to harm the person. So it's truly just an antidote for that.
Thank you. Sheriff Hardwick, what role does social media play in the selling and distribution of illegal drugs?
The social media. How do you hear me now? The social media has really given us, it's totally given us new variables: accessibility, easeability. When I was growing up, and even when I first started in law enforcement 30 years ago, you bought the drugs from a street corner. I mean, that's kind of where you got your narcotics at. It was usually, I hate to say it, but it was a dirty neighborhood. It just, the normal aspects of buying narcotics wasn't like seen like it is now. What's happened now is you can cold contact anybody now via social media. You can actually schedule delivery time. You can pay electronically. It's not too far from the conversation we had about in the school district with these kids, with these vapes, is that we've lost kind of control, basically, of what social media has done. And, as a high school football coach here in St. Johns County for almost on my 30th year, the peer pressure these kids have on them, again, I'll kind of go back to when I was in school. We all had peer pressure, but not what they have now. Because what's happened now is this demon that we all carry around and our kids carry around has made accessibility. Everything is accessible, not just narcotics, not just illegal drugs, but also, too, what's going on in the world, whether it be pornography. We had an internet crimes against children detail where people have access to rape a child, by the way, rape a baby, from getting on this phone and actually making contact and meeting somebody that's willing to give up their child for an amount of time. So when I talk about, it's using emojis and code words that we have to decipher. We have to pick up on this stuff. We have to basically, reinvent the wheel of how they're actually selling these narcotics. So social media has opened up truly a can of worms.
Absolutely, and I think it's important because that's where the dealers are, that we should have some campaigns that are on those platforms as well. And so we were able to partner with our friends at HIDA. We mentioned them earlier, the provided data, and Community Coalition Alliance, who's provided the Narcan for us this evening to hand out to y'all. We partnered with them to come up with a social media campaign called Anything But Obvious. And we have a slide that we're going to put up on the screen. It has a QR code. You can take your phone out and shoot that QR code. It'll take you to the campaign's website. But just for perspective on what this is doing, how it's doing, we ran it for 7 months here in this market. Includes Duval County, Clay, Nassau, St. John's. And we had over 3 million views of the ads that were running on this campaign. Now, some of you, like me, you won't see these ads because they're directed towards young people, towards those who are 14 to 24 years of age. But just warning them about the dangers of fentanyl and telling them, to be careful and to not take anything that doesn't come from their doctor. So those ads continue to run in counties all around this region, 23 different counties, thanks to CCA and HIDA and the partnership we have with them. So just trying to meet kids and folks, young adults, where they are on social media platforms. So TikTok, YouTube, which is where we're streaming this event right now, Instagram and Snapchat. We know Snapchat is where a lot of young people are ordering their drugs. And like you mentioned, it's like DoorDash. You could order it now, and you could go outside and then pick it up out front, and it's unbelievable the access that people have through social media. So.
Just TJ, one thing I want to add too is, we try to educate the parents too the parents of holding their kids accountable, but holding the parents accountable too, that they're involved in their kids' lives. And I think what's happening now is the kids control the parents. I'm just being honest with you. And with that being said, they're controlling the parents by this object they call a cell phone. So we actually give out a handout that shows the 15 most common apps that kids are downloading that have accessibility to, of course, the internet, social media, and evil things like buying drugs. But also, too, we teach them, too, that and actually, matter of fact, these are some of the kids at Decoy Creek High School when I was coaching football last year. They showed me on a phone, actually, that, where like you were to track, if you were to walk, 10 miles today, where the little heartbeat on there shows how many miles you walked, how many steps you did. Well, they have an app, actually, that's a fake heart. And actually, so your parents never check it, but on there, of course, was pictures and other things they were actually doing. So they were showing us that was an app they download on their phone that looks like if their parents would look at it, that's their walking and their talking and that kind of garbage, and it really wasn't. It was actually an app to do illegal things on the internet.
It's unbelievable. And I'm a parent myself. My daughters are a little bit older now. They're in their mid-20s, but when they were high school students, middle school students in my home, I got this advice from someone, and we employed it. When it was time to go to bed, we got their phones and they charged them in our room because we knew that they had the temptation to be up all night looking at their phones and nothing good can happen. So parents, if you want to use that, feel free. You can tell your kids, you blame it on me. Tell them where you found or got that idea, but I think it was helpful. And kids have access to all kinds of stuff any time of the day, but they don't need their phones in the middle of the night for what it's worth. At least that's my opinion. Superintendent Dresbeck, what partnerships have you found to be most impactful as the school system addresses this issue?
So that's a great question. I do a lot of work around the state, and I represent, administrators throughout the state of Florida. I've gone to Tallahassee many times and talked to different agencies. St. Johns County is very unique in that all the gentlemen that you see here on this panel, those were out at the tables that you saw this evening, but also many other county agencies that no matter where there's a call or a need, that we reach out, there's always somebody who's willing to step in and be able to say, where can we be able to help you? Just some of the ones that have really done a lot of work with us when it comes to mental health, when it comes to supporting our students, Epic, SAYS, even players, with a lot of the grant work that they've done to be able to support our work. The sheriff's office has committed to having a youth resource officer in each one of our schools, whether it be an elementary school all the way up to our high schools. Another one that's been a huge asset to us is St. John's Care Connect. That was Flagler Hospital, now UF Health in St. John's. But what they do is that it's an umbrella organization for us, where we can actually make referrals for students that have needs, and then we can be able to try and get them seen much quicker than what you would see if a parent were to just call a local agency. And so we've been able to bring that down from anywhere from 60 to 90 days out to where we can actually get them seen by someone within 30 days. First intake appointment within 14 days. That's unheard of in many parts of the state. It's actually a model that the state of Florida has actually funded just recently with the legislative session to expand past St. Johns County into other counties around the state.
Yeah, it's good to know that there are new and innovative things that are occurring. The system is not perfect. It's broken in many different ways, but people like these organizations that we have tabling, they really have a passion to help people, and it's so good to see collaboration occur and kids and people just get the services that they need. So
that's the thing that goes along with that is it's not just the kids who are suffering. It's parents, it's grandparents, it's their siblings, because they see these behaviors and it affects them. And that's what's very unique about this opportunity is that it expands services beyond just the student, because that's what St. John's Care Connect asks about, is what other social determinants are going on? Who else needs help in your household? Because it's not usually just one person, it's multiple. And we've got to be able to look at it more holistically than there's just one issue or one problem. And that's what's, again, unique about St. Johns County is we're trying to look at it from many different avenues, not just from a crime and punishment. That's where the sheriff has people that are coming out from stays. When they have crisis in a home, they're sending out mental health counselors with them to be able to see what can we be able to do to help that family. So again, it's all part of what you just talked about, reaching out and being able to see how can we do it better rather than just saying, well, we'll just keep doing what we've been doing.
Yeah. I'm glad you mentioned mental health. This is going to be the last question. I wish we could keep going, but time does not permit. But I want to pose the last question to Mr. Dickinson. And I want to ask you, what role does mental health play in substance misuse and what a lot of people refer to as addiction?
Sure. Well, like Shay was saying, most substance use disorder starts with mental health disorders. They are self-medicating. They're trying to shut their brains down. They don't know that there's services out there, professional services, especially at a young age. They're not going to come to the provider and say, oh, I can't shut my brain off. They're going to try something, their friend gives them something and it helps them, so they keep on using it. So that's the underlying kind of driving factor, is that we need to treat these mental health issues better. We need to address them sooner. Case in point, please speak to your legislators. In 2012, there was legislation to allow nurse practitioners to practice independently, but they only allowed that for primary care because the intent was to extend the access to primary care. However, the need is much more greater in mental health than it is primary care. But we cannot practice independently without having to pay a physician, and most physicians ask us to pay them $1,000 a month. So that limits the number of providers that can be in the market. So please talk to your legislators to push these laws through, that we can have independent practice, because that expands our abilities, that expands the numbers of providers, and there's plenty of states out there that nurse practitioners can practice completely independently.
Thank you. And thank you all for being here today. Can we give them a hand? We really appreciate your time and your leadership in this county, and we're grateful for everything you're doing. So as our panelists exit the stage, I'm going to invite Captain Gabrielle Mignanti, North Florida officer in charge of drug demand reduction and outreach with the Florida National Guard Counter Drug Program, to come to the stage for her presentation. And let me just say, as she's coming, what you're about to hear is something that you can do to make an immediate impact, just like these gentlemen were saying. Thank you, Captain.
Okay. Nope. Probably not going to use that. But I've had to talk to hundreds of soldiers at once and make sure they all hear me. So I've been told I have these two cameras, so here goes nothing. All right. So good evening, everyone. If I take my first slide up there, that is introduction. So just a real quick idea of who I am and why I'm up here. We work for the Florida Counter Drug Task Force, or Florida Counter Drug Program. So in the state of Florida, along with 41 other states, and their respective national guards, they decided that the soldiers who are working and signed up for that 1 The worst thing you can do is put them in little baggies or containers that make sense to you. Now I cannot identify what they are or who they belong to. Okay? As far as children go, use child-proof caps. Most prescription medication bottles are hard to get into for a typical child, actually a typical adult. Thankfully, but that's for a reason. And then other adults. So with older adults who are in your household, be aware of them. They might not grab the right bottle. They might not be able to read the name on the front of the label. So be cognizant of that, potentially putting it in a lockbox. And then folks in recovery. So we know if we have somebody in our home in recovery, we have to be super hyper-vigilant. Oh man, my red arrows were not supposed to be over those pictures. They were supposed to pop up. But at the top there, you'll see recommended disposal methods. Okay, so there's 3 primary disposal methods. Permanent drug drop boxes. On the next slide, I will show you a picture of one of them, but maybe you've been in a Walgreens or a CVS recently, and you see them sitting there. They usually have a drawer that comes down, you drop your medications in, and you close it, and you cannot get back into access. Take home drug disposal bags. I'm going to talk to you more about those in a moment. And then the last one was our biannual, can you go back to that last slide? Our last one is our biannual drug take-back initiative. That happens in April and October of every year, and these great organizations that you see outside support law enforcement at a given, provided ahead of time location, and usually it's a drive-through, and you might go to an elderly loved one's house, or you might go in your cupboards and just throw everything in a bag. It's outdated, it's expired, I don't need it, and you dispose of it on those given days. They're National Drug Enforcement Administration, DEA, prescription take-back days. So if you ever see advertisements, that's what that is. It's a quick opportunity to drop everything off. And at the bottom there, the pictures that are hiding underneath my red no-no signs are in the garbage and in the toilet. Unfortunately, for many, many years, people thought I'm just going to toss them in the toilet and flush them, or I'm just going to put them in the garbage. Aside from that being unsafe, the garbage, because they can still be retrieved out of there, being flushed down the toilet, now they're getting into our ecosystems, our water systems, and affecting unfortunately, yes, but our oceans, you know, I mean, we have so much water around us, and there was alarming statistics on how much prescription medication flushed into the system has affected our coastlines. Next slide. So if you'd like, I did test this QR code out. And what you'll find in the QR code is how to check on your where your take-back day locations are in April and October, how to find permanent drop boxes right now that you can go to. I checked before I came here. There are 7 within a 10-mile radius of where we are right now. There are 7 permanent drop box locations. So it's just about on many corners right around here, okay? And then next slide. So I have my counterpart here. This is Tech Sergeant Robert George. He's going to help me show you all how to use what is called the Deterra drug deactivation system, okay? So it's this little bag. You all have been given your own Deterra inside your white bags if you grabbed them before you came in. So you go in your cupboard and you find a bunch of pills, maybe 3 or 4 bottles. I just grabbed one, but you're going to go ahead and open it, okay? I'm going to toss my pills in there. I don't need that water. Whoever's this was, I'm using it. And you're going to leave it open for just a minute, let some air get in there. But that water, the activation particles are water soluble. The only way they're going to get activated and start breaking down the chemicals of that medication is by water. You have to add water. You go ahead and seal it up. You're going to give it a little shake to activate. Yep, there you go. And then after about 3 to 5 minutes, you're able to just toss it in the garbage. It is no longer harmful to the environment at that point because everything has been properly and responsibly broken down. Okay, you can just about fill this up. Okay, as long as you can fit water and prescription medication and close it, it's good to go. So you can get rid of quite a bit of medication in that bag alone. Okay? Next slide. All right, so I'm going to say this wrong, but I'm going to try. Dr. Yes. I studied it for a whole minute over there before I came up here. I still learned it, so I'm sorry. But you did a wonderful explanation of exactly the science behind Narcan, so thank you. I didn't have to cover that, so I'm just going to show you all how to use it. In case you are unfamiliar with it, these are the boxes. I saw some out there that were a little bigger, but they both come with two sprays inside, 4 milligram sprays each. This is what it looks like after you peel the aluminum foil off the back for the aluminum close. Here's your nasal spray, okay? Thumb goes here. These two fingers go here. You're going to put it in the nose so that these two fingers are touching up underneath the nose. I'm going to reverse just a little bit. Depending on the situation you found them in, sitting, laying, you're going to want to put them on their back, and you're going to want to lift their head so that that opens up the nasal cavity, okay? You're going to enter that into their nose, and in one swift push, you're going to push the pink button all the way up so it enters. There's one dose in here. You can't prime it. You don't need to get it ready. Only push it when you're ready to administer it. You're going to give it about 2 to 3 minutes to see if they wake up, okay? Because what the opioid is doing is making it difficult for that person to breathe, so they might be in and out of consciousness. Ideally, when the Narcan works the way it's supposed to, and starts to remove the opioids from those receptors and replace the spot at the end of those receptors, now the person is ready to get back to somewhat regular functioning, and they will wake up. If after 2 to 3 minutes they are still not responsive, that is why almost every box now does come with 2 doses. It is very, very common to have to use the second dose. Something important to note, I heard somebody outside ask a wonderful question. Can I give it to somebody I'm not really sure if it's an overdose? Absolutely. There's no harm. I could take this right now and get down and go home and drive home in about 30 minutes. It won't harm me if I'm not overdosing, but it will certainly help me if I am overdosing. And then, well, are you sure I should give them that second dose? Isn't that going to be too much? No. If they haven't woken up and they're not responsive, absolutely administer the second dose. Excuse me. And while they are coming to, or if you're waiting for them to come to, you're going to want to put them in the recovery position. As you see up here, I told Sergeant George I wouldn't make him come up here and get in the recovery position. He's done great work in the last couple of weeks, so you heard that. But the recovery position here is you're going to make sure your hands under their chin, supporting their head, so they're not falling with their faces to the ground. This arm is out to keep them stable. This knee is also out to keep them from rolling onto their stomach. But the reason we want to turn them from the position we had them on their back is so that if they do start to throw up, or they have trouble, if they start to coughing, that stuff can come out. If you're laying on your back, it's all going to be stuck there. That can be more harmful. Okay? Let me make sure I touched on everything. Yep. So that's everything I have for you. Again, it's just, you also got Narcan in your bag, so now you can go home with Narcan you can use. Keep it on your person. It's all too often that we're walking in and out of grocery stores or wherever we are in St. John's, Duval, all over Florida. You could potentially run into somebody who's experiencing overdose, and you could potentially save their lives. Additionally, your doTERRA bag, please go home. I promise just about everyone in this room has a medication somewhere at home that's ready to be disposed of. This is your opportunity to do that. Any questions? Oh. I'll be completely honest with you, I don't have the scientific answer. I'm sure somebody does. Mine has been in my car since I've started doing this, and if I see somebody, I'm absolutely going to use it. But scientifically, I'm not sure if it loses its potency in the heat. Yes. It does get too hot. So if you can keep it out of your car, unfortunately that is the most mobile and ready place anyone in Florida can have it, but if you can keep it out of your car, out of the heat, that is the best form. Thank you all.
Thank you, Captain Ignanti. That was my water bottle, but it's a small price to pay, sacrifice to use that. One of the things that she mentioned, and I just want to reemphasize, is if you do have to do the second application, do it in the opposite nostril of the first one. So you want to make sure if you do it twice, you're doing it in both nostrils. And I think I just want to know, like by show of hands, how many of you think you could do what she just showed us? Like take the pouch home. That's all of us, right? It's pretty easy. And then I think with the naloxone, that's something that we could all do as well. And just so you know, you are protected by the Good Samaritan law. there's no liability associated with administering Narcan whatsoever. That's a question we often get. So thank you so much, Captain Mignanti. And I have with me here a story of hope. So you heard what we often refer to as a story of tragedy at the beginning of this. Somebody right here in your county that has passed away of an overdose. Now we have somebody here in your county who has come through the other side of his addiction for many years and his substance use disorder. And so I got to meet Ridge a few weeks ago with Abby, who is our program manager for Project Opioid, and I haven't introduced her yet this evening, so I'm going to make her stand up. She's in the front row. Can you stand up and turn around and wave? Yeah. She loves it when I do that, so I had to get that in. But we had lunch with Ridge and heard his story, and I was blown away. When I tell you there is no drug that Ridge has not used at some point or another in his journey, he could sit down and tell you things that would blow your mind. But we have him here because he's living proof that if somebody gets the help they need and you have the support and people that will walk alongside you, you can come out the other side of this struggle. And now he is using his experience to help other people who are in their journey of recovery. So I want to ask you a few questions, Ridge, and we may go over time a little bit here, but I think people are okay with that. We've had a lot of good stuff happen this evening, but keep in mind, we're trying to get them out as soon as possible. And I say that because you got so much stuff you could share.
I know.
So please share with the audience how you found yourself in a battle with substance misuse.
So I've been thinking about this question, and I'm so glad that you shared your story tonight because, I did not grow up in a bad home. I did not grow up in a bad environment. I mean, you could be my mother. You could be my father. I mean, I related so much to what you shared about your son. I mean, it's crazy, but, my personal beliefs on substance use disorder is it's something that's always been with me. Any room that I walk into, when I was young, before recovery, any room I would walk into, I was either the best person in the room or the worst person in the room. But I was never like everyone else. I never fit in anywhere. I, was constantly searching and obsessing and, until I got in recovery, I just felt like I was the only one in the world that thought the things that I thought and did the things that I did. And I remember, the first time that I used a substance, it unlocked this thing in my head, like, oh my gosh, I finally feel at peace. I finally feel like I belong in the room. I finally feel a part of. And I didn't realize till later in my recovery that, and this is, again, my personal belief about recovery, that I had a spiritual void. There was a spiritual void within me that just needed to be filled, and no amount of substances or, material things could fill that, and, as far though as my, early use, it started, typically like they would show on like a Dateline episode or anything like that, like marijuana, cocaine, ecstasy, things like that. And then, it gradually got worse and worse to the point that I was using intravenous drugs, like we talked about, and even drugs that I don't think that you guys have heard of yet, but yeah, it got pretty bad.
You were fentanyl seeking at that point, right?
I actually was not fentanyl seeking, which is the scary part about fentanyl. So when I was doing opiates and heroin and different things like that, I did not know about fentanyl yet. Fentanyl wasn't a big deal. I think someone said it started around 2013 when it kind of started entering the area, but I just remember that, one day around, I think it was 2017, my dealer had sold me something, and he said, this is the white stuff. He's like, I wouldn't take this if you can like absolutely not take it because some of the other people that have done this white stuff have been like falling out, AKA overdosing. And so I would, I kept it in my kitchen cupboard and I tried not to do it, but the man over here just explained withdrawal and how it feels, and it's tough, even if you know something is going to kill you, if you feel like it can take you out of withdrawal, you'll still take it, as crazy as that sounds. So that's kind of, it started, getting injected in the drugs that I was taking over time.
I think it's important what you just said, that it doesn't matter what the risk is for somebody who is addicted to an opioid,
Right.
that they're going to do whatever it takes to avoid a withdrawal.
Yeah, exactly.
Can you describe just, and most of us probably won't be able to relate, but could you try to help us understand what it feels like to go through that type of withdrawal?
Nightmare. It's a nightmare. And the crazy thing, too, is when you're an addict, I do not like to be uncomfortable in any way. It's just a part of my genes as someone who has misused substances. And the crazy thing about it is, and he was speaking on this too, opiates hijack your brain. And it hijacks the way that your brain thinks. So you're constantly seeking more. And by the time that you're fully hijacked, after months and months of using opiates, years and years and years, all you can think about when you wake up in the morning is, I need that substance. I need those opiate receptors to get stimulated at all costs. And so every morning when I would wake up, I would feel cold sweats, extreme nausea, vomiting, diarrhea, things like that. You feel like you want to jump out of your skin, and I mean that in the most literal way. Everything feels like sandpaper on your skin. You have teary eyes. You're constantly yawning. And you're not necessarily having hallucinations or anything like that, but the depression is so heavy. It is unimaginable. I have general depression just in my daily life as a recovered person, and the depression that you experience during withdrawal is unlike anything that I could ever explain. So as someone who knows that the drug is right there to take, that will take you out of that misery, it is a really hard cycle to break.
Your story is so fascinating. I could sit here and talk to you for a long time, but I'm trying to be, I told you we need to be mindful of the time, and I'm the one that's extending it. But
Yeah, for sure.
You had mentioned at one point the young lady that you were dating, that one would have Narcan while the
Right.
other used.
Right.
And knowing that it could potentially send you into an
Yeah.
overdose and even
So what
result
he's
in death.
talking about is I was dating a girl in Asheville, North Carolina, when I was using the majority of my opiates, injecting opiates, different things like that. And as I had talked about, fentanyl kind of came onto the scene, and thank God there was a needle exchange in Asheville that gave you clean needles, and they also gave you Narcan, which was a huge deal. It saved my life. Narcan has saved my life. I've been injected with Narcan. I've been given it nasally, different things like that. But I had described to TJ that there was an instance, first of all, where we had gotten the white stuff, and it was in the kitchen cabinet, and my girlfriend was like, do not take that. We have enough like heroin. You don't need to take the crazy stuff. And I waited for her to go to sleep, and I did a shot of it, and I woke up from like the blackest, darkest dream like imaginable, and there were 12 EMT around me. I guess what had happened is I shot up the Narcan, fell out. I can't believe like I'm on stage telling a bunch of strangers about this story. It's crazy. But I shot up the fentanyl. I fell out, and my girlfriend, for whatever reason, because she was on drugs too, woke up. and I was blue and purple like they had described, like I was like having the death rattle and different things like that. And thank God she called 911 and they shot me up. I think it ended up being around 16 milligrams of Narcan when it was all like said and done, but it took about 15 to 20 minutes to revive me. And, you know, it's crazy to think about because if she wouldn't have woken up, I'd be another statistic, you know. And you know, eventually, because we knew of what would happen when we shot this stuff up, when we would shoot up after that, she would watch me and wait to see if I fell out, and if I did, she would Narcan me, and then I would do the same for her. I mean, it was sick. It got to a very sick point, but that's where addiction will take you. So
I know it's surreal for you to sit here and
It
like you
is.
said, share this, but I'm grateful that you're willing to, and I think this is eye-opening for people to hear, you know, and the fact that you're sitting here, you know, that's hope for somebody who has a family member, a son, a daughter, somebody who's struggling and maybe even in the grips of it like you were, like they can, you know, they can recover. So what is it that led you to seek recovery?
Oh, man. I told you this. I ended up in a hospital in 2021. I was taking this drug that I had found online that they're prescribing as a tranquilizer in Russia. Anyway, I was taking way too much of it, and I ended up running out of money and running out of the substance, and I went into a withdrawal, and they didn't have any withdrawal protocol for this drug at the emergency room, and I blacked out. And you know, I'm from Hilton Head, South Carolina. I went to the ER in Hilton Head, and when I woke up, I was in Tampa, at a hospital in Tampa, and I had a breathing tube and a feeding tube, and my parents, you know, thought I was going to be a vegetable, and if I did survive at all, like, it's crazy that I'm here. Sometimes I still feel like I'm not here, and this is just some weird hallucination. But I'd been to treatment centers before and rehabs and detoxes and things like that, obviously. But when I woke up from this and you know, when I saw kind of that I was not in control of the consequences or in control of what I could do to myself or the people in my life, the people that I hurt, et cetera, I had the desperation to get sober, you know. And that's the thing that sucks about all of this, because we can talk till we're blue in the face about how we can get sober and how we can recover and what can we tell our kids and what can we tell our girlfriend and what can we tell our neighbor and all this stuff. But it's got to come from in here, you know. And that's the sad part and the great part at the same time. Like, when people recover, it's so incredible, you know. I mean, they're the most amazing people I've ever met in my entire life, but it takes a lot to get there. As you can hear with me, it took almost dying not once but several times. So,
And I think that's important for us to remember, those of us who are in this space doing this work. We just got to keep showing up until they're ready, right? I mean, we got to keep doing what we do, and I know it's difficult. I know some of you are here, and maybe you showed up today and you're like, I gotta go to one more event and set up this table and share with people what we do, and, you know, probably nobody's even gonna call me or whatever. You never know when that person's gonna walk up and you're gonna help them, and it's their time. And so I wanna encourage you, you probably speak to this too, like, keep doing what you're doing. You're making a difference, and the more we can come together and do this type of stuff, the more people, you know, will benefit from it, the more lives that will be saved. So what's life like now for you? Share kind of what you're doing and your new organization you're working with and the great work that's happening there and what you get to do
thanks.
for a
Yeah.
living.
Cool. So yeah, I work for an RCO called Discover and Recover.
Tell them what an RCO is.
Oh, sorry. It's a recovery community organization, and we just opened up in St. John's, and we're killing it. Like, I work for some amazing people, and we basically are a nonprofit, and we do peer recovery services. And so I'm a peer, recovery specialist. And I work with other peer recovery specialists. And what we do that's special is not only are our services free, but we all have a history in recovery. Meaning that if I go meet someone who wants to use our program, I can look them in the eye and say, I am your peer. We are no different. The only difference is time. And we meet people where they're at, and we take people in all types of different walks of recovery, and we all love what we do. I mean, I was telling Abby before, we started today, like, I've been studying this for my entire life, just not in the way that most people do.
You're a subject matter expert.
I know, it's
right?
wild, it's wild, but I like live to tell the tale, I guess, and just super grateful to be here tonight. Like, you asked, like, what has changed since I've been in recovery. I'm on a panel next to dude, if I was next to a sheriff 6 years ago, it would not be like this. I can tell you that.
I'll tell you what, though, if you were next to that one, he would put his arm around you and
No
support
doubt,
you.
he's a great guy. And,
Last two things, and I know we're over time, but man, I want you to answer these last two things, because there could be somebody that's watching, live stream or recorded later, the playback, or right here now that's struggling with this issue just like you were. Right. And there's definitely people here that care for people that are struggling with this issue. So can you speak to each of those? And if I have to repeat it, I will. But the first one is somebody that was like you. What would you tell them?
Yeah, it's already been spoken about tonight, but you're not alone, and there's always an answer, right? So if you feel like you're overwhelmed and you don't know where to start and you don't know, how am I not going to withdraw, or where do I go for something like this, or I don't have insurance for treatment, or my family doesn't have any money, or I don't have a family, I don't have a home. Like, there are answers for all of these things. That's what I do for a living. That's what, a lot of these vendors out here do for a living. Like, you don't have to be alone, and there's an answer for every single thing. There is. And that's like what makes me so sad. Like, thinking about myself in the past, like, if I could go back to my younger self in addiction, I would tell him that, that there is an answer for everything, and you're not alone.
That's so good. What about the people that care for people that are struggling? What would you tell them?
Find a group. It doesn't matter what kind, but find a group, because, like, I think more than anything, even us who love people who are addicted as well, in a sense, have our own type of addictions, right? We have our own types of codependencies and different things that we need to work on sometimes. I'm not speaking for everyone, but my biggest suggestion is find a fellowship of people, who have gone through what you're going through and who have gotten out on the other side. I mean, I recommend that for anyone in any situation, but when I look at, my parents and you guys and think about, the answers, I just think about my mother, and she was just completely alone during that whole time, and I had to watch her suffer in a big way, and I wish I could go back and tell her, there are groups out there who can support you and help you while you're going through this. It affects everyone, so.
Yeah, what I hear you saying is to both people that struggle and those who care for those that struggle, you're not alone, and reach out for help.
You got it, man. You got it.
Man, I knew this was going to be good, but I didn't realize you were going to do this. I didn't know you were going to kill it like this.
Me neither.
Great job. Appreciate you sharing your story. Thank you, man. Thank you for your patience. I know we've gone over a little. I'm going to ask Pastor Doug to come up. He's going to close us out real quick in prayer. I want to mention a couple things before he does. Narcan and Datera, okay? The bag went somewhere, but she's got it. Can you hold it up, Captain? Just take those home, please. There's some out there. If you did not get Narcan or Datera, take it on your way out. And if you did, take some more, because this stuff can save people's lives. Go home, clean out your medicine cabinets, clean out underneath your sinks. If you're not using those prescription meds, get rid of them safely and dispose of them in the way that she shared with us. Also, community organizations will be out there to help you. Abby, is there Chick-fil-A left? Please take some Chick-fil-A with you on the way out. If you didn't get to eat, grab a box. And then, is the Hidden in Plain Sight trailer still up? Do we know? If you didn't get a chance to look at that, that might be of interest to you. Prevention Coalition of St. Johns County had it set up out here to the right as you exit. I'm getting nods in the affirmative that it's still up. So please go look at that, especially if you're a parent. It's going to show you some things that might be shocking, but definitely helpful. Again, thanks for being here. Thanks to Fruit Cove Baptist Church. Pastor Doug, you're going to close us in prayer, and then y'all can be dismissed. We appreciate your time here this evening.
All right. Thank you, TJ, for asking us to host this. It's been incredible that we can be part of this, part of the community, and just be able to help and provide resources. And just thank you to the vendors, the panelists. Just thank you so much for everything you do. So we'll go ahead and close out in prayer, and then we'll be dismissed. Thank you, Father, for tonight. Father, that this is just heavy information. We know tragedy occurs because of just drugs in our culture and just what it's doing to our communities, our families. Father, we are fighting a battle that we can't win without you. And Father, we pray that you would go before us, that your Holy Spirit would equip us. Father, your word calls us to bear each other's burdens, Father, so that we can step into each other's lives and help one another, Father, and not be isolated from one another. And so, Father, thank you for the opportunity to learn about the epidemic of the overdose and just how it's just tearing us apart. And Father, that our hope is in you, that those that are out there that know that they're not alone and that we can be here to help them. So Father, we know that you are the answer in all this, and that we would turn our hearts and our minds to you, that your Spirit would go before us, Father, and for those who are struggling with the addiction, that you will soften their heart, that your Spirit will wake them up and convict them, Father, and bring them back to you. Lord, we love you and thank you. It's in Jesus' name we pray. Amen.